Are you unhappy with your vision after cataract surgery? Maybe you had a multifocal or even a traditional lens implant, and now you see significant glare and halos, or things are just not clear enough, or just out of focus. Even if you heard from your surgeon that nothing else could be done and that you need to just live with it or adapt to it, I'm here to argue otherwise. In this video, I'll discuss a new surgical approach I've used successfully time after time with great outcomes. This approach is so new that it has not found its way to books and publications yet. And if you stay with me until the end, I'll reveal the #1 secret to knowing if this surgery can help you before you go through with it. Hi, my name is Dr. Ilan Cohen. Over the past 20 years, I've performed tens of thousands of cataract surgeries. A significant portion of these procedures involved the use of multifocal lenses. Throughout my experience, I have encountered a range of issues related to lens implants. I've learned how to resolve these problems and ideally how to prevent them from occurring in the first place. Unfortunately, some surgeons regard complaints related to lens implants as psychological or adaptation problems. You may be shocked to learn what lecturers and speakers that are on the lens industry's payrolls tell surgeons. They mostly say that this problem is rooted in your obsessive-compulsive tendencies, or in other words, it's all in your head. They tell surgeons to hold your hands and compassionately guide you to adapt to your new vision and embrace it as your new reality. I strongly disagree. The problem is very much real and physical and can be corrected in the vast majority of cases by a simple approach that I'm about to explain. You see, our understanding of this issue has evolved rapidly in the past few years, and although patients who have cataract surgery are generally delighted with their vision, some are not happy or even are miserable. Some of them had a multifocal lens implanted in their eyes to see near and far without glasses, and some have poor vision after using traditional monofocal lenses. If you belong to either of these two groups, do not worry. A lot can be done. So what is the source of the problem? The real issue is often an uneven surface on the front of your eye called the cornea. This unevenness, known as corneal aberrations, can make things look blurry and cause glare and halo. Topography-guided PRK smooths out these irregularities. A device called a topographer creates a detailed map of your cornea. This map guides the laser to precisely reshape your cornea, making it smoother and creating a better match with the lens implant. The results can be very striking. Patients who had cataract surgery on both eyes but only had issues with one eye often find that topography-guided PRK fixes their problematic eye so well that they want the other eye treated too, so that both eyes can see equally well. Stay tuned until the end, and as a bonus, I'll tell you a simple way to find out if topography-guided PRK could help you even before the surgery. Topography-guided PRK has been a game changer in my experience for patients who had problems with their vision after cataract surgery with multifocal or monofocal lenses. Unfortunately, not all cataract surgeons have experience with or have access to this technology. Also, because this solution has not yet been widely published in books and research articles, awareness of it is relatively low. Lastly, I'll discuss the final and most definite solution if nothing else works for you, and that is a lens exchange procedure. Sometimes the lens implant is just not a good fit for your eye, and it needs to be exchanged for a different lens. A lens exchange procedure certainly carries risks. However, these risks can be significantly reduced with experience. I perform these procedures routinely, mostly as referrals by other surgeons. Before you decide on any procedure to correct your cataract surgery, you need to talk to your doctor and make sure that there are no other more obvious problems that could be responsible for your issues. These may include retinal problems, severe dry eye issues, or a need for corrective lenses. Now, here's the bonus I promised. Is there a way to know before surgery if topography-guided PRK will work for you? Before any procedure, I like to test your eye in the office by putting a hard contact lens on it to see if your vision improves. Most of the time it does, which makes me confident that the laser treatment will be successful. Wearing a hard contact lens smooths out the surface of your cornea, and it's a simple test any eye doctor can do in the office. If you see better with a hard contact lens, then topography-guided PRK is likely to help. Please put any comments or questions in the section below and consider subscribing for more videos on this topic.